Hey, Brian.
Hey, can you hear me okay?
Yep, I can hear you.
Okay, I'm going to go ahead and share the presentation and start with the housekeeping slide.
Okay. For whatever reason, the participant or attendance list isn't refreshing for me. It was still showing just one. I have to hit the refresh button, which is weird. So I didn't see you until I hit refresh.
I know
That's
that yeah, for me, it's starting to work a little bit.
um, let's see if I can make you presenter. Oh, you got it. Okay. Hey, Mary. Hey, Lindsay.
Hello.
Okay, I think can you guys see the first page of the presentation, the housekeeping issues?
Yes. Yep.
I can.
Okay, we'll get started right at 6 o'clock.
Okay.
Okay, everyone, I have that at 6 o'clock. I know we have a pretty small group tonight, but that's just fine. We knew all along that when we did the evening presentations, we were doing them for convenience for folks, and they're really important to us to maintain. So I want to make sure we've got the recording started, which I think I see the little red dot meaning we do now, so that's great. I want to let people know that this presentation, along with this recording, will be posted on our EVV website, like all of the presentations that we do. Just to go over some housekeeping things, if you have audio issues, you may want to log out and log back in. We've also heard that headphones sometimes cause problems. So you may want to think about whether or not you're using headphones. Also, if you could please put your questions in the Q&A section and not the chat section if you have them. If you could put questions in Q&A and submit them to everyone, not just the host. Make sure that you don't put any PHI or any personal information in there. We don't want to get anybody in trouble or reveal anything that we don't need to. All right, let's go ahead and get started. This is our evening September electronic visit verification meeting. My name is Brian Dowd. I'm the Deputy Executive Director over Policy, Operations, and Compliance at the Department of Community Health, and I've been working at EVV on EVV for over 3 years now. We always like to start every presentation of the Department of Community Health with our mission statement, which is to provide Georgians with access to affordable quality health care through effective planning, purchasing, and oversight. So what are we going to go over today? We're going to do the EVV member update for those individuals that are participant-directed or self-directed. We're going to do a project update. We're going to talk about EVV training. We're going to go over some common issues and questions. We're going to give you information on EVV Townhalls. We're going to talk about the ever popular third-party vendor integration update. People really like that one. And then we're going to do Q&A at the end as time permits. So let's start with EVV member updates. We did in a previous presentation, I let you guys know a couple of months ago that we were going to start every presentation now with self-directed or participant-directed updates. We did do some specific self-directed or participant-directed updates, but we want to make sure that we are targeting and highlighting you all as you have asked multiple times. And we're going to be accommodating to that because that's good on the state's part to be responsive to its members. So the most important thing for you guys to know in the self-directed community as far as updates is that we have extended the mandatory claims deadline from October 1st to November 1st, 2021. And that's to allow fiscal intermediaries to work with you guys to make sure that you're up and trained and that nobody loses service as far as their employees and the training that may be needed. So for self-directed members or participant-directed members, the mandatory claims deadline for EVV is November 1st. This extension only applies to self-directed members and is not applicable to traditional providers. They're traditional providers who are not self-directed. The deadline remains October 1st, 2021. So just a couple of weeks away. And one of the main reasons we did this is because public partnership has decided they no longer want to be a fiscal intermediary in the state of Georgia. They had about 105 total members, 75 or 76 of which that were actively engaged in the program and not just receiving respite services. So if you are a public partnership member, you should have heard from support coordination or public partnership by now to give you the option to transfer either to Acumen or Continuum, both of which are working very hard to get members trained and updated, including the members that they're getting transferred from PPL over the last 2 weeks. I want to also point you guys in the self-directed section to resources. If you have questions for Acumen, Continuum, or public partnership, these are specific emails that are associated with their leadership and call-in numbers. So you can call them, you can email them, and these are leadership at each of the FI organizations. Often I get emails and calls and texts from members and participant-directed members, and I usually just refer them back to these contact information so they can get the responses that they need. So one other thing that might be of interest to both traditional providers and self-directed members, and then I think from this point after this slide, if you are a self-directed member, you're welcome to stay on. If you're participant-directed, you're welcome to stay on through the entire presentation. We always welcome your participation and we're very thankful for it. But this will be the last slide that is really applicable to you. And that is that you are eligible for a free Lifeline phone. So Medicaid members, whether you're a traditional provider and you're helping Medicaid members through aids in the home, or whether you're a self-directed member and you need a phone to schedule doctor's appointments, to keep track of your medical records, and for EVV purposes, you are eligible for a free phone through Georgia Lifeline. That phone has unlimited talk, it has unlimited text, and any data associated with EVV is free and not counted. So you get an allotment of free data minutes with your Georgia Lifeline phone. It's not unlimited Wi-Fi, but the EVV app is not counted towards your data minutes. So there is no reason why you, even if you use up all of your data minutes in the first week, you would still be able to use this phone for EVV purposes. We also want to let you know that there are other federally sponsored smartphones that are free to Georgia Medicaid members, but the only one that we know absolutely works with Mobile Caregiver Plus and the EVV application for TELUS is the Georgia Lifeline phones. These are new phones, they are not reconditioned phones, and they have the software that is needed in order to download the app for EVV, or the hardware. It's one or the other. I'm not much of an IT guy. Okay, so at this point, we're going to talk mainly about traditional providers, but again, self-directed members and participant-directed members, we certainly encourage you to stay on if you want to hear the other updates. So where are we in the process? We're past the required deadline date for registration. We're past the required date for each provider ID to submit a claim. And we are marching forward for traditional providers to an October 1st, 2021 mandatory claims submission date. What does that mean? That means that in 2 weeks, you will no longer be able to submit claims directly to GAMIS. All of the claims will need to go through the EVV system. If you have an open ticket with TELUS where there is a problem, NetSmart, I'm going to keep using NetSmart, where we have identified that there is a problem that is a state problem and not a provider training problem, or a provider not having a PA from their case management company, or a member mismatch in the file, but truly an EVV issue, we will allow claims to be submitted through GAMIS through an override. But you do have to have an open ticket that shows that the problem is an issue with the EVV system. And that is as of October 1st. So if you have not registered and submitted a claim for each applicable Medicaid ID, you need to do that immediately. And you need to text the EVV mailbox, which is in this slide, evv.medicaid@dch.ga.gov, to let us know that you have submitted a claim for your ID. We are reviewing the claims information right now, and we do plan on placing people on prepayment review. So it is very, very important that you get at least one claim in if you have not already done so. And that claim can be accepted, it can be denied, it can be submitted, but we need to be able to see that you have a provider, an aide that is clocked in and clocked out, and you've gone completely through the process to submit the claim. Case management update. We anticipate case management functionality to be available September 16th, which is tomorrow, 2021. Registration and access to the EVV administrative dashboard is optional for case management agencies, but it will provide you with real-time or near real-time view of what is going on in personal support services and community living services for your members. It will be another tool in your toolbox that you are able to use to make sure that you have appropriate plans of care and are taking appropriate actions for your members. You will only be able to see your members associated with your provider ID for your agency. So you won't be able to see all your members, but you will have a window into the members who are associated with your case management agency. Case management administrators will need to register and input employees just like the rest of the service providers. And then those administrators will be able to link the case managers to the Medicaid members. Here, coming very soon, later this week and next week, we're going to have training guides, checklists, and all kinds of different communications that are available. We're also working with a small group of case management folks that are kind of our early adopters and testers of the program to make sure that we have a smooth rollout of the case management functioning. Here you will see what case management functionality includes. It's view only, and it allows you to look at schedules of your members, visits of your members, and prior authorizations of your members. But you also have access to reports to look at things like visits completed, but not pre-scheduled, visit detail, when did they arrive, when did they leave, what recipients are getting services. And a big thing is you'll have the ability to send and receive messages to and from your aides. So your aide could message you and say, hey, Brian, I got to Mrs. Smith's house and she's in the hospital. I thought you would want to know that, because you do need to know that as a case management agency, because when Ms. Smith gets out of the hospital, she may have a greater need for service, or maybe she needs adaptive technology or durable medical equipment and supplies if she's had a fall. So it's important for a case management functioning for you to get that information as quickly as possible. And often the aides are the very first people to know what is going on with our members. Okay, I'd like to do a little bit of refreshing around EVV training. If you are a provider using the NetSmart system, it's really important that you have registered for and completed all three of the following training webinars: Administrative Console, Mobile Application, and Claims Console. So if you are an administrator, an owner of an agency, you should have already completed these three trainings. Let me say that again. You should have already completed these three trainings. Your caregivers or aides should have already completed mobile application training. You should not be trying to figure this out on your own. We have a lot of training resources that are there and available to you. I get a lot of questions to my personal email box and the EVV mailbox that are answered by training resources. So I don't mind answering questions, but I'm not going to walk every single provider through trainings when we have those readily available online. It's your responsibility as one of our enrolled providers to afford yourself of the trainings that we are making available to you. If you're using a third-party system, administrators still need to register and complete the Claims Console training. You don't need to complete the NetSmart, your aides don't need to complete the NetSmart training on the application, because they're going to be using the application of your third-party administrator. Where are the trainings? They're at this website. So even if you haven't registered, you can go to this website and you can do what I just talked about: Administrative Console, Claims Console, Mobile Application, right? It shows you how to register. It shows you how to view pre-recording webinars at your convenience. If you have a question that training did not answer, there is a weekly Q&A session that NetSmart provides for all of its states. So it's a live Q&A session that is an hour long where you can sign in and ask anything you want, and they will provide training for it as part of this Q&A session. Once you are registered as a user, you can have access to all the user guides and short refresher trainings. So you go into the dashboard on the left and you go down right here where we're showing you the training, where the arrow is pointing to, and you have user guides. You can print those user guides out and hand them out, or you can watch the short refresher videos. I have watched every single short refresher video. They are incredibly useful. They are everything from how to reset your password to how to submit claims. And they're very short and to the point and engaging and step by step. They work very well for someone like me who does not have a very long attention span. So they are very, very super helpful training videos. I strongly encourage you to go in and look at those and just know what's available for you on your dashboard. Great, now let's move on to some common issues and questions. We get a lot of questions about what about retroactive billing and Medicaid pending. We heard in the last webinar, somebody said that case management or support coordination, often there's a delay in getting a new prior authorization for services in. What are we going to do? Well, if the member is known to the system, if it's a renewal PA or there's a lag, you can still schedule visits for that member. The visit will just remain in an unmatched status until you get that updated PA. Once you get that updated PA, everything should match up and then you can submit the claim. However, if this is a new member that you've never had before and they're new to Medicaid and they've never had a PA for the waiver before, we're going to have to wait for the Division of Family and Children's Services or the support coordination and Alliant to get that prior authorization into the system. Once that member eligibility and the prior authorization is in the system, then it will move over nightly to the EVV system. But you're going to need to keep information on paper and then go in under the administrative portal and enter in all those dates with a reason code for the prior months for a brand newly eligible person. So I get a lot of questions about, hey, I'm still missing members. So Medicaid members come directly from the GAMIS system. We have to have a PA for services before it moves over. If you have a PA for a member for your agency in GAMIS, and it's been there more than 5 days, you need to call the call center and ask them why that member is not showing up in your files. It shouldn't take more than 5 days once that member appears and their PA appears, their prior authorization for your agency appears in the system. It should not take more than 5 days to show up. So you do need to call the call center if it's been more than 5 days and you're still missing a member. We're getting a lot of questions from traditional providers about family caregivers and how long we're going to continue to be able to use family caregivers. I can't really give you an answer on that. Family caregivers are tied to the public health emergency and specifically to Appendix K, which are provisions that let us do extra things during the public health emergency. We have not heard anything about the public health emergency ending at this point, so the Appendix K is still in effect, and we anticipate being able to tell providers 90 days in advance of any changes to our current policy for the public health emergency. So we'll give you plenty of notice if anything changes. Third-party vendor integrations. We'll go over that at the end of this. So I want to make sure that people know, though, that the mandatory claims edit does also apply to third-party EVV vendors. So just because you have a third-party EVV vendor doesn't mean that you can continue to bill through GAMIS. That third party has to be integrated with our EVV solution so that you can make sure your claims get paid. We will continue to work with third-party vendors through October, but eventually we will set a cutoff date for those folks to say, hey, we've tried to get you integrated and we can't get you integrated. We'll go over the list of everybody who's fully integrated. It's quite a large group of third-party providers. So make sure that you are doing your mandatory claim submission before October 1st, just so that you can make sure any bugs or tickets or calls that you need to do have been put into our call center. This is just a visual representation of when you're using a third-party vendor. So the aides and caregivers will use their chosen third-party system, whatever you chose to use as a provider, and the EVV solution that you've chosen will then capture all that information and send it to the NetSmart system. The state EVV solution then checks all the information that your third party has sent to say, yep, everything looks good according to what's required by EVV, and we know this is an active member, and we know we got a PA in the system for that member, right? Then you as a provider go in and release all the claims that your third party sent over to EVV. Those claims are paid just like they have always been paid through GAMUS, and they get back to you on your remittance advice. If you need support, I've talked a lot about the call center. This is the information for the call center, 833-701-0012, and this is the email. If you go to our EVV website and click on what's new, it's about midway through the page. It is also on the last 3 or 4 or 5 town hall presentations that are also on our webpage. So it's in multiple places on our website where you are able to get this information. And I want to remind you there also is a website for chat as well. If you're just easier to chat with a live human being, we provide that option as well. Upcoming town halls. We have another town hall on 9/28, and that's right before the mandatory claims live claims go live. Mandatory claims edit goes into place. So we're doing another open session on the 28th. On the 27th from 3 to 4 p.m., we're doing one that is specific to case management and support coordination for town halls. In October, we will be doing another set of town halls, again in the afternoon and one in the evening like we're doing right now. We haven't decided on what topics are going to be presented, likely a lot of things associated with the mandatory claims edit. But we will be having those presentations. We will also be presenting an EVV module at the Medicaid fair for all providers. So that will be in October. It's towards the end of October. So that will be another session where we discuss EVV. Okay, this is the alternative EVV vendor update. Ooh, let me go back. It does that. I don't know why it does it. But so as you can see from this, there are a ton of providers now that are in production. Counted this yesterday, and I think it's 23. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23. I was right. There are 23 third-party providers that are fully integrated and in production with our EVV system. That's quite a feat, and something that the state of Georgia has provided to our providers that not a lot of states do. A lot of states just tell you, okay, you have to use the state solution. Or many states have told their providers, you have to, at your cost, go out and get a third party, and then you have to integrate with our GAMUS system. But in this state, we wanted to provide options. So we allow you to use the NetSmart system for free, or you can use your third party. And we already have 23 that are fully integrated. That is quite amazing. We have another 10 right here that are in pilot. That means they're passing data back and forth, but they have not yet made it into full production. So they're well on their way if they're in pilot. And then there's another 4 here, 1, 2, 3, 4 that are testing. So they've started the testing process, but they're not fully in pilot. So if you take the folks that are in pilot or in full production, because in pilot is very close to being into production, and I have no doubt these 10 will get there by the end of the month. You have over 33, you have 33 options, and then the state solution for a 34th option to becoming EVV compliant. Again, this slide will be posted on the Georgia EVV website, so you can look at it at any time, and you can certainly go back to it as you need. Okay, here is the Q&A information again for the call center and the email address for the call center. I'm going to leave this up while I look and see what we got here. I'm going to start in the chat because we did have one in the chat, and it said, I submitted a ticket 3 weeks ago and never heard back. I had to enter the visit manually because the aide cannot get in. Could you tell me what I need to do to make sure they are able to get in the visit? They were given a log word password and accepted. They are still unable to get in. So if you are a traditional provider, you would need to call the call center and they can walk you through what you need to do. If you are a participant directed member, you are going to need to either use those resources for Acumen or for Continuum and call your fiscal intermediary so that they are able to walk you through what you need to do and make sure everything is up to date. Let me real quickly look at the Q&A. Right, I don't see any Q&A. I think something else just came in chat. So it says, I've had a problem with searching for a client in the work list. Has anyone else had this problem? I have not heard that problem, but I would strongly encourage you to call the call center and get just some training resources available on how to search for a client. And they can check to see if your client is actually there or if there's some other issue. So please do in the morning, call this call center and walk them through the issue that you are having.
Hey, Brian, if you don't mind me adding to that as well, we have heard that issue sometimes, but I would just also make sure if you have several Medicaid IDs, if you just double check that you're on the correct Medicaid ID and toggle to the correct one if that's an issue as well.
Okay, thank you for that, Brittany. Would you know why we cannot, again, something came in the chat, would you know why we cannot change information and tell us, and we have tickets for 3 weeks now and still no help? No, I don't. No, I don't know what your individual issue is. You're welcome to send it to me and I will follow up with TELUS to see what the issue are. We do know we have some open tickets around things like rounding rules, but we can certainly be able to track back what your issue is. No issue have we not been able to track back and respond to. Okay, I'm going to pause for just a minute to see if there's anything else. I believe the R0 error has been resolved. If you're still seeing it, please let us know. All right, seeing no more questions or comments, I definitely want to thank you for your time this evening. I know it's in the evening, but I really do appreciate you all being involved. And as always, I appreciate all your questions and comments. It's very much been a main player, an integral part of us implementing the federal mandate of EVV. So I hope you have a wonderful night, and thank you very much for your participation.